Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Desmoid tumor. So we're looking at some important points. It is an unencapsulated fibroma. Unencapsulated fibroma. And it arises from the musculo-aponeurotic structures. From the musculo-aponeurotic structures, and it is present below the umbilicus. It is below the umbilicus. So here it is the females which are greater than the males in terms of occurrence, and it is extra-abdominal. It is extra-abdominal, which is greater than, so it is about 65%. This is greater than abdominal, which is about 25%, and this is greater than the intra-abdominal, which is about 15%. This is associated with the FAP, adenomatous polyposis. FAP associated, that is the Gardner syndrome. Next, the infiltrate surrounds the tissues but no metastasis. So the infiltrates, it surrounds the tissue, but there are no metastasis and no sarcomatous change. There is no metastasis or sarcomatous change. So what is the investigation of choice? The IOC here is going to be the MRI. And what will be the treatment? The treatment will be a wide local excision with the negative margin. So it is a wide local excision, and this is with a negative margin. The other treatment aspect will be, it is more prone to recurrence. So there can be increased recurrence. Here it should be treated with the surgery as well as the radiotherapy. To learn and grow daily like this, please do subscribe.